हेलो सीआईएल सिक्योरिटीज।
हेलो।
हाँ सर, ऑडिबल है ना आवाज?
है ऑडिबल है।
ओके सर, वील स्टार्ट राइट ऑन टाइम। ओके।
नो। ओके ओके।
16 మెంబర్స్ వచ్చారా సార్?
Okay, so we'll start. Is CIL there?
Hello.
हाँ sir, audible है ना?
Yeah, audible है.
Okay sir, we'll start now. Okay.
Yeah, please.
Right. Good morning, ladies and gentlemen. I extend a sincere and warm welcome to the Board of Directors, the members, to the 22nd Annual General Meeting of Jeevan Scientific Technology, and appreciate your interest in being with us today.
लैपटॉप से म्यूट करो लैपटॉप
I request the scrutinizers to please mute themselves. In view of the ongoing pandemic COVID-19, the 22nd AGM of the company is being held using video conference or other audiovisual means mode. I would like to take you through certain points regarding the participation at this meeting. The facility of joining the AGM through video conference or other audiovisual means is being made available for members on first come first served basis. To avoid any background noise and to ensure smooth conduct of the meeting, all the members who have joined this meeting will be placed on mute mode by the host. Once the question and answer session starts, the names of the shareholders who have registered as speaker shareholder will be announced. Subsequently, they will be unmuted by the host. The speaker shareholders are advised to put video on while speaking. If speaker shareholders fail to speak using video mode, he or she may speak using audio mode with earphones on. If there is any connectivity problem at speaker's end, we would ask the other speaker to join in. We would like to request shareholders to kindly restrict their interaction to 3 to 4 minutes. During the proceedings of the AGM, if a member faces any issue, they may contact the helpline number mentioned in the notice of the AGM. The company has taken requisite steps to allow members to cast their votes on resolutions being considered at this AGM. Since there is no physical attendance of members, the appointment of proxy is not applicable. The registers, as required under Companies Act 2013, are open for inspection. The members attending this meeting and have not voted through remote e-voting can cast their vote at the end of this AGM using CDSL e-voting website. A 15 minutes window after conclusion of this AGM will be allowed for the members to cast their vote. I take the privilege in once again welcoming the directors of the company to 22nd Annual General Meeting. I also welcome Secretarial Auditors, SSAD and Associates as scrutinizers. And I request the Chairman, Sri Koteshwara Garu, to kindly address the shareholders.
I request the Company Secretary to read out the resolutions and notice.
So first we will do the speech. Okay. Out of the 4 resolutions being considered at this AGM, 2 are of ordinary business and 2 of special business. The resolutions are: the first one, to receive, consider and adopt the audited standalone and consolidated financial statements of the company for the year 1920 together with the report of Board of Directors and auditors thereon. To appoint a director in place of Mrs. K. Vanaja, who retires by rotation and being eligible offers herself for reappointment. Third one, reappointment of Dr. M. Rajendra Prasad as whole-time director and CEO of the company. Fourth, reappointment of Mr. G. Bhanu Prakash as an independent director of the company. I request the chairman, sir, to kindly address the shareholders.
Good morning, ladies and gentlemen. I extend a warm welcome to you all for this 22nd annual meeting of your company. I take this opportunity to appreciate the members for promptly adopting the new mode of participating in the AGM through video conferencing, and hope that you and your family are healthy and safe. In view of presence of the quorum, I call this meeting to order. Since the annual report is already circulated to all the members, I will take it as read. Now, regarding the business of the company, going on to the updates. Indian generic market is a 40 billion industry, and the estimated size of the DABE services market is 0.1 billion. That is about INR 800 crore market in India. Within the next 5 years, that is between 2020 and 24, patent drugs in sale The sales potential of 170 billion will be losing patents. On average, 40 to 50 drug molecules are losing patent each year only in the US market, and that creates growth opportunities for generic drug companies. The BABE market is estimated by IMR 18 crores and is growing at a CAGR of 8%. Pharma companies outsource almost 70% of the BABE studies so that they get an independent review of the drugs. Your company is an independent CRO and you have good chances of getting this work done at our place. Pharmacovigilance is a service required by both generic pharma companies and also innovative pharma companies, and this is a mandatory requirement of the sponsors. The market in India is estimated at INR 8,000 crores, that's 550 US million, and is growing at CAGR of 15%. The market is similar to IT and BPO services, and therefore is dominated by IT majors like Cognizant, Infosys, etc. In recent years, several global CROs like Covance, Paraxin have established offshore centers in India to take advantage of the 30 to 40% of the cost advantage in India compared to the US and Europe and the availability of skilled workforce. Clinical trials are an important activity in the new drug discovery process, that is phase 1 to phase 3. Clinical trial projects in India since 2017. The clinical trials market is back at historical levels. The market size in India is INR 3,500 crores. Although India has 20% of the world's population, the market share in the global clinical trials market is only 1.5%. So the potential for growth of the clinical trials market is high. Even in the Indian market, the domestic clinical trials market has started increasing due to changing regulations. In the BABE market, growth opportunities exist in innovation and also driving cost efficiency. As market trends indicate, the growing segments within BABE are specialty generics going forward. Your company has the ambition to become a full-service clinical research organization, expanding its service portfolio. It will focus on building the pharmacovigilance and clinical trials businesses. Within pharmacovigilance, your company would like at targeting small and medium-sized pharma companies and building its internal capabilities through automation. Within clinical trials, your company would look at both international and domestic opportunities. In the BABA business, the barriers to entry are low, and this has resulted in many new players entering the market and creating a pricing program. To deal with this, clinical research organizations like your company have to be highly efficient. Regulatory changes are another threat to the business. Approvals by various regulatory authorities like DCGI, USFDA, and ANDA create demand in CROs. In recent years, regulation both in India and US have been favorable to pharma-related business in India. Your company's current business model consists of executive projects which have a duration of 6 to 12 months. During financial year 1920, your company has successfully implemented a new project costing system. This system has given management more significant control of all the project activities and project costs. During the year, the company has implemented monthly budgeting and monthly financial controls. Management has implemented new routine in the clinic and the lab for bed capacity utilization and plan. The most significant is in the company business is getting an observation during a year's FDA audit. The company has been focusing on being prepared for these surprise audits with a well-defined quality management system. During financial year 1920, ES FDA audited the company and there has not been a single observation. Today, 4 ES FDA audits and 1 WHO audit have been conducted successfully. CROs are a people-centered business and your company employs about 200 persons and the management team has more than 200 years of pharma experience. In 2019-20, Jeevan took several initiatives to improve people's focus in the company. Towards the end of March 2020, the government started implementing COVID-19 related lockdowns. These restrictions have impacted business in financial year 1920 and will continue to affect the company in the current year also. However, the management of the company is taking all necessary actions in mitigating the risks associated with COVID-19. Current outlook. Based on the recent market trends, the outlook for CRO such as BA, BE, PV, and CT looks positive. The overall focus on digital and innovations in the company is high. Several automation projects have been initiated and are ongoing. Entry into new segments like complex generics is being planned and executed. The overall focus of being a full-service CRO will enable your company to provide a range of services to its existing customer base. Focus on delivering high-quality service on time and at competitive prices should allow the company to improve customer satisfaction.
Thank you, Chairman Sir, for the speech. The shareholders who have registered, we will now take questions from the speaker shareholders. Request the shareholders to speak when their name is called out. The shareholders who have registered themselves to speak are Mr. Ramesh Manguluri, Mr. Bharat Kankanala, and Mr. Praful Chavra. CIL Securities, can you please unmute Mr. Ramesh Manguluri if he is present?
It seems he is not present.
Okay. The
His name
next,
is not displaying.
Mr. Bharat Kankanala.
Bharat Raj is there. One Mr. Bharat
No, the
Raj.
name is very specific. It says Mr. Bharat Kankanala.
But here, then it seems that even he is not present if he is Bharat Kankanala.
Okay. And Mr. Praful Chavra?
Praful, he is there.
Okay. Kindly unmute him, please.
Mr. Praful, please unmute yourself and speak.
हेलो सर हेलो हेलो सर मेरी आवाज आ रही है सर हेलो
हेलो प्रफुल्ल
प्रफुल्ल
सर।
जी, आपके बैकग्राउंड में कुछ चल रहा है, आप आपके बैकग्राउंड को म्यूट करिए।
सर मेरी आवाज आ रही है क्या आपको?
आवाज आ रही है, बोलिए।
हाँ सर, बोर्ड ऑफ डायरेक्टर्स, चेयरमैन सर, सबको मेरा नमस्कार सर। कोरोना टाइम पे फर्स्ट टाइम मीटिंग हो रही है, तो अभी 2 मंथ हो गया मीटिंग करते करते, तो भी कुछ समझ में नहीं आता है कि मीटिंग में कैसा बोलना, क्या करना। हमारे कंपनी अच्छा काम करती है, आगे बढ़ती है। किशोर सर जो काम कर रहे हैं इसके लिए मैं बहुत धन्यवाद देता हूँ कि कंपनी और भी आगे बढ़े। और कोरोना टाइम पे अपने स्टाफ के लिए आप क्या कर रहे हैं? स्टाफ घर पे काम करते हैं या ऑफिस को आते हैं, उसके बारे में बताएंगे। धन्यवाद सर।
What is the company doing for the staff during the pandemic?
Hello. Hello.
Yeah, our company is taking all the safety measures to take care of the staff welfare, as well as the volunteers who are participating in the study. We have taken enough measures of our staff, their safety, their well-being, and at the same time, while continuing our business as usual, we have taken all the precautions.
With those words, I want to thank all
Hello.
the...
One second. We have got a message from Mr. Bharat Raj stating that he is only Mr. Bharat Kankanala.
Okay, please go ahead and unmute him. We'll take his question as well.
Okay. Hello, Mr. Bharat. Mr. Bharat.
Yeah,
unmute.
connect. Yeah,
Yes.
unmuted. Yeah, very good morning, Chairman, entire board of directors. I'm audible.
Yeah, very much. Please go ahead.
Yeah, Mr. Chairman and Mr. Managing Director, Mr. Kishore, I'm happy to see you safe, healthy, and fine. I'm Bharatraj calling from Hyderabad. I'm also safe, fine, and healthy. Chairman and our chairman is wonderful, Chairman. I have one question in regarding this corona. Is our company is involving into the human trials? Is any plans to enter into the human trials, or we are getting any opportunity in the market all over the world to go into the human trials, sir? That is my question, sir. And under the leadership of our chairman and managing director, we have trust in his leadership. We are very proud of him. Definitely, our company will be see a very bright future in coming years. My request is be safe, sir. Be happy, and happy everyone, sir. And one more question is that in this pandemic, any salary cut, or any employees has been terminated, or management has taken any salary cut? That is my second question, sir. Once again, take care, sir. Be happy, be safe, sir. Thank you very much.
Yeah. We received some queries with respect to taking care of the COVID-19 studies during the pandemic starting stage. At that time, actually, only the government is allowed to do these trials. Now there are more trials which are in generic and in nature, the same business of our work, and that business of work really increased because of this COVID, because all the medicines required for the people are required to be manufactured by these companies. That is point number one. The second one is with respect to the salaries of people. We can say that we optimally utilized our resources which are available to the company in making sure that we provide sufficient fund to the entire employees of the organization. I can say that there is no salary cuts, as well as there is no terminations of any employees from the organization because of this COVID. And that is one actually one aspect we have taken as a management to take care of our people so that they will take care of us going forward. Thank you.
Thank you, Rajendra Prasad, sir. With those words, we come to an end to the question and answer session. I want to thank all the shareholders for taking the initiative for joining this meeting and also working with us patiently to conduct this meeting. I thank all our directors for their time and participation in the meeting. The scrutinizers may now conduct the e-voting procedure. The e-voting window will remain for next 15 minutes to enable members to cast their vote in case they haven't through remote e-voting. The results would be announced on or before 30th September 2020, and the same would be intimated to stock exchange and uploaded on website of the company. With this, the 22nd annual general meeting comes to an end. Thank you. CIL Securities, you may kindly end the meeting. We are done.
Thank you.
Thank you.